This is Impact Healthcare, people and strategies that are disrupting the health benefits industry. And now, here's your host, healthcare benefits industry expert and the originator of the transparent health benefits movement, Lester Morales.
Welcome back to an episode of Impact Healthcare, and I have a guest that in our world as advisors needs no introduction. She's worn many hats, but the hat that she wears the most is domination, and she has not done anything second place or half ASS. She is a woman who gets things done. Jessica, welcome to Impact Healthcare. For the crowd who has never met you before, give us an introduction of you and your great organization.
Awesome. Well, thank you. You must have been speaking to my husband for that intro. Hello, everyone. I am Jessica Brooks Woods. I am the CEO of the National Association of Benefits and Insurance Professionals. So if you are a broker, or you're an agent, you're an independent agent, if you're with a mid-sized company, a large organization, I represent you. You are my people. NABIP is your association and your federation representing you in Washington, D.C. to the marketplace. So I'm super, super excited to be here. I'm joining you by way of Georgia, work in D.C. from the Berg, for those of you who are Steeler fans. So happy to be here.
I won't say anything because I'm a Tampa Bay Buccaneers fan, but we'll leave that alone for a little. So, Jessica, I wanted to start because I think, I don't know why I didn't think about this before, but you are so perfectly suited to run an organization that represents what I would call the advisory side of the business, because your earlier career was representing employers. So can you give the audience a kind of snapshot of what you were doing in your previous life? And I want to dig into that side because, again, the connection between the two, I don't know what took me so long to figure this out, but I think it's just brilliantly suited to represent that side too.
Yeah. So for the last 10 years, well, I've been with NABIP for a year. So the 10 years prior to that, I led the Pittsburgh Business Group One Health, which is one of 50 employer-led healthcare coalitions across the country that are members of the National Alliance of Healthcare Purchaser Coalitions. National Alliance, for those of you who may be aware. And during that 10 years, I also sat on the board of the National Alliance for several years and really helped facilitate the healthcare agenda from an employer-led perspective for the country in that role, as well as led one of the largest, more progressive regional healthcare coalitions in the country out of Western Pennsylvania. And my members were employers. So we actually had very strict bylaws that ensured that no less than 70% of our members could be purchasers. So those were our base members, small size companies to the largest companies. So if you know PNC Bank may be familiar, or Alcoa, U.S. Steel, school districts, public entities, the city of Pittsburgh, Allegheny County, the county in Western Pennsylvania, those were some of our members. So a very diverse public, private sector. It's a very paternalistic region. So it's large companies, but some of those large organizations could have 13,000 employees and still be fully insured. So a good mix of both fully insured and self-insured employer groups. And a good group of them had employees all over the country as well. So that's where I was for a good bit of my time. And you're right. Advisors were associate members. They were there in the room. They were members. They oftentimes had speaking engagements with the organization and ways to partner with us uniquely. But it's a definite shift to represent the employer purchaser voice and then to represent the advisor voice, which I do today. And so I'm happy to dig into some of those dynamics.
Yeah. So the first question I think that would come to mind, if an employer's listening, right, they have maybe their own representation of, hey, what are they doing? What do they hear? What do they feel in their market? If maybe they're part of their association, like you said, their whatever city group on health, they might be part of that. But very few people have maybe touched and spanned, so much. If you had to say top 2, top 3 lessons or top 2 or 3 things that every employer you heard was struggling with, what are a couple of the top things that come to mind?
Oh my goodness. It's interesting when you ask to rank it, because my ranking maybe sound a little different than what you would hear most times, which is cost. I'm sure you would hear probably top 1 or 2 or 3. And yes, cost, top priority issue. But during that time and over the years, the market dynamics have begun to change drastically as far as the level of mass consolidation that's happened in the market. And Pittsburgh and Western PA was kind of the epicenter of that, meaning we had, by the time I left Pittsburgh, probably only 10% of physicians, and that's a mix of primary care to specialty care, were independent still. So the 2 largest integrated deliveries and financing systems owned the providers, right? And so that dynamic really helped shape what those priorities were over the years. And in 2014-ish is when, a lot of consolidation had already happened, but then there was a war on the insurance access and who would have the contracts to cover those lives. And so access for the first time in a long time had taken a priority over cost. And what does access look like, and how do we define access, and how do we actually help people know and understand if they are getting quality care if I'm an employer and I've chosen something that wasn't necessarily popular to them? For example, it was a Blues-dominated marketplace for so long. When Aetna, Cigna, and United were able to come in and take advantage of this infighting between the provider and the insurer, they looked at them like they were like ABC insurance company. It wasn't like Aetna, United, and Cigna had this great brand. They weren't necessarily there and trusted there at the level that people were accustomed to, right? So it was the first time that purchasers had that level of competition at an insurance, on the insurance side, the financing side. Then there was...
So I want to ask you a question on that and make sure the audience knows on this. So when you say that consolidation, you're saying, hey, Dr. Jones now works for that hospital over there. And, the conversation behind that is, how do you know you're getting the right representation, right? So if I work for that hospital over there, obviously my referral patterns are going to be only to that hospital. And if that hospital makes a decision to only like the color green, then that means a bunch of other people have to go color green.
Certainly, yes. Continuity of care was a primary concern. Who my folks have access to and who they're going to be referred to, right? And the level of lack of transparency that existed. So I would say access, transparency, cost, and quality were the top 4. And it could have, depending on the size employer, whether or not they were national or global employer or a regional employer, determine which one of those were 1, 2, 3, and 4, right? But what I do appreciate of what that bubbled up was prioritizing quality, that they had to actually identify where safe care is, where quality care is, not just how to get access to the care that existed, now that they had to make different choices than they ever had to in their purchasing careers. And I think that's what made that market so fascinating and interesting that many other markets are experiencing today. Yeah. And have for many years looked at Pittsburgh on how purchasers, employers were navigating those dynamics.
So, Jessica, when you think about, the representation, right? I mean, you do have some very unique marketplace, right? UPMC, a large healthcare system that also happens to be an insurance company as well, have a health plan. You've got Highmark, Blue Cross Blue Shields, that is the dominant player. And so between those two organizations represent a significant amount. Let's leave, the details behind that. But when you think about how the largest of the largest employers were shaping their plans, that you saw, man, they were achieving success. Are there any commonalities to what it was they were doing as very large or in a marketplace? What were the employers doing that were achieving success?
So what was important as a leader of a coalition that had to help guide the marketplace from that perspective, from a value purchasing perspective? We were pure play. No other objective but to help you make the best decisions for your business, for your people, and for the greater economy, right, of the region. Like, how do we help you navigate this? And data became our priority. And how do we extract and get data in a marketplace that's 80% one insurer and 90% one provider, right? So to speak. I mean, it's not as that drastic now, but that's pretty much how people saw it and interacted with the system there. And so data, those who really kind of separated themselves from the pack had to begin to look at data, demand their data. So we had actually orchestrated a partnership with several different data vendors from a quality perspective, free access to data such as Leapfrog for safety, to organizations like Quantros at the time, and CareChex, which was free platform for you to be able to go and see, if a procedure was an A grade or B grade or D grade, depending on which facility, which doctors. So we started pulling out that data, and then we weren't as fortunate as some states to have an all-payer claims database. So it was really up to the employers to come together and be willing to share their data in an aggregated source. And that's what we initiated over that time. And there were others in between. I mean, Truven, I can remember us looking at shoppable procedures specifically on, is this low-hanging fruit? If we look at these shoppable procedures and we see this cost variation, just by plan design, we can save money quickly and we can help people save money quickly, because at the same time, high-deductible health plans were becoming more popular. And that was a market that didn't adopt them quickly. But once it adopted them, it adopted them. And so costs were shifting. I say all the time, one guarantee in healthcare, shift happens. So costs are shifting to now the families in a unique way, which creates a whole different level of dynamic and need for visibility. So I would say those who were willing to separate from the pack and share data, look at data, make decisions based on data, saw results sooner than later. And carve out, many of them started to carve out their drugs from their health plan. Many, our coalition actually had a group purchasing organization for prescription drugs for about 20 years. So we helped that, but then every large consulting firm ended up doing the same thing. And so we just saw this navigation of conflicts of interest, needing to have objective third-party advising to help you make decisions. And so I guess the answer to your question are those who were willing to actually see those dynamics happening and be willing to bring in new players to help them navigate a lot of the opaqueness that existed in how they purchased for a long time, but they recognized it now in a different way. And I can tell you some of the public sector employers, like there was a school consortium that represented nearly 50,000 lives. They led the way. It was the large private companies. It was those who also had to respond to taxpayers, who recognized that children, their future of education in our region depended on them being able to actually make hard decisions for healthcare to save money. But they were paternalistic at the same time and weren't going to just cost shift. So they actually had to make the hard decisions, which was to address the issues. And they began to do that, making primary care free and other strategies like that. But it also steered people to places that have higher quality that ultimately saved the money. And that was one of the most proudest, I think, success stories under my leadership there in that region.
So, and when you look at that, taking notes, data obviously drives everything, right? Because if you don't have data, you can't even tell anything up, down, left, right. What is quality? What is expensive? What is not expensive? What's the average? All of that jazz. And then, I think one of the things that I took from that is even in a market that was as strong, and arguably I can only think of maybe one other market that is so dominated by a less, by less number of players, right? I mean, you're talking, to your point, 80% by the same insurance company and a big healthcare system. But there were still organizations that, call it bravery, call it tired of the status quo, call it, I'm not putting up with anything else, like took that leap and went outside of that piece of it. And the results were there. The results of impacting their employees. So you said, hey, a public sector, consortium, those are, we need good teachers because they're going to teach the future kids of, so you see all that. If you were talking to a room full of employers, knowing what what's that piece of advice you give to them, knowing that you saw that transformation from, hey, very heavily doing it the normal way to a bunch of bumps and bruises, a lot of battles with, different types of people. What on the other end of that hindsight 2020, what do you say to a group of employers?
There's a couple things I would say. Well, one, it seems so insurmountable. And yes, data is power. We need data, but you don't have to wait for perfect data. And we didn't in that marketplace. We did not have perfect data. In fact, the health system had meetings with them, and they criticized the fact that we were looking at data in this way and told us that if you make decisions based on this data, all you're going to do is take the lower cost providers and make them increase their prices. They're going to level up. We're not going to level down, right? And so we had to call their bluff. We had to be willing to do that and act collectively. And so one piece of advice is I totally am a believer in the work of coalitions and collective action. And that doesn't equal antitrust. People will try to scare you to say that means antitrust. But working and learning and understanding collectively could be your competitive advantage. And so join like-minded folks who want to actually work harder, because it's going to take that.
100%.
Your willingness to work harder, and that lives are depending on it. I used to say on the stages of my rooms, like, well, we're not surgeons. This isn't life or death. And over my career, I've realized this is life or death. Like the decisions you make as an employer, that from the level of copay to the exposure and out-of-pocket maximums, and who's in network, who's not, how people navigate, and the tools you help them to navigate that can really be the difference between someone getting care they need, avoiding care that they need, and dying from it or living from it.
Well, and that death might be physical or it might be financial,
or having such a difficult quality of life that they're bankrupt. They can't really have a quality of life at all because they've become indentured servants to what you provided them access to. And when we recognize we are on the front lines of that as purchasers and employers, that hits different, right? And it is the responsibility of it. You may not have thought you signed up for that when you took the role, but that's where healthcare has taken us to this point where you're in that driver's seat, and it's a big responsibility. But I also want to tell them to give themselves grace. As long as you're moving forward and you're willing to do the hard work, you're willing to find out what you think you know and know it so you can't unknow it, and you act upon that. Give yourself grace, because there's lots of challenges they're facing. The financial component of it, who to partner, who their advisor should be, right? Then those who surround that advisor should be. All of those decisions. And then there's health equity, recognizing that everyone isn't faring well and the same in the system that you're providing access to. And how do you account for that? And so I ultimately, when I speak to purchasers, I end with saying, choose to do no more harm. Admit that you have been doing harm.
Right.
It's okay, because you've been a part of this system that you just, but you have been. Decisions you've made have ultimately provided harm or access to harm.
Yep.
Choose to do no more harm. And if you lead with that and you're willing to accept that, then I have all the faith in the world that we'll be able to ensure that all people in this country have the access to the care that they deserve, and companies are able to thrive and hire more people and impact the livelihoods of our communities.
Yeah, the way I use the Spider-Man quote, right? With great power comes great responsibility, and knowledge is power. So, hey, you might have not, when you walked into this room, knew that you had another option or knew that you could do something different. But now that you know, it's now your obligation. It's your power, right? Because you have now that responsibility because you gained that knowledge. Now go forth and don't step on that same banana peel that you did back there. Like, it was fine when you walked in that says, I didn't know any better. Now you know better. Speaking of now knowing better, so now you were representing employers, and funny that you said, hey, you were doing harm before. Now let's flip this over to the side of the house that, I always say this. I thought I was a pretty good advisor until now. Knowing what I know now, I look back at the old advisor and says, that guy sucked. And talk to me about maybe your first aha. Now you take over the reins of NABIB, and the first thing you did is rebrand, right? So it used to be a much different name. Tell me your first aha, or your first couple ahas that you're like, I got over here and started representing the other side of the coin. What are some of the first things that you thought of that's like, oh my gosh, this needs to change?
Yeah. So while honestly, I had to fake it till I made it, because it was a total paradigm shift. Every coalition in this country, I'm not going to say absolute, but most purchasing coalitions in this country representing employers have advisors on their SWOT analysis as a threat. Consultants, brokers, advisors, they were like necessary evil.
Interesting.
That had to be in the room, that you had to invite, that you had to engage. But not necessarily that you wanted. In fact, I had most employers didn't want advisors in the room. They wanted theirs in the room. And there's a difference. They trusted Mark, right? But they didn't necessarily trust yours. So this erosion of trust that's happened over time has been happening for a long time. And I only really saw it on that side, right, up until now. And so I came in understanding that. And with that filter, right, that, and why? I get asked the question, well, why were advisors a threat? Well, oftentimes when you're looking at value-based solutions, disruptive solutions, maybe a different type of PBM, right?
Don't move my cheese.
CPA, or, we would be, and then purchaser would be excited about it. We would go through a process. They would be a part of the process. It was their coalition. So oftentimes they would be a part of vetting and looking at different solutions and innovations. And then we would say, let's do X together. And then they go and they say, okay, I need to go talk to Norm, or I need to go talk to Katie. And it would go quiet. And so innovation or progression literally lived or died by that next conversation of meeting with their advisor. And so that's why they were threats. We just couldn't crack that nut. And when we did, it worked really great. When we banded together, it moved. I remember a major cancer issue that happened when an insurance company unilaterally made a decision not to pay those facility charges as increased cancer rates based on site of care due to consolidation. Now, they didn't consult the employer, which is where they went wrong. But when we were, as self-insured employers, required to pay nearly $200 million back to the provider, we came together with advisors on how to navigate that. We used data. We sat around the table. So there were times where the magic happened when we could be together. But oftentimes advisors didn't want to sit in the same room with one another, as that's everything they did was this great secret. And as a result of that, it created division and constant division instead of us banding together as representing the purchaser to make moves. So coming to NABIP, and I was aware of NABIP. I actually had the former CEO speak at one of my conferences. We wanted to understand the consultant advisor voice. We wanted to leverage NABIP to be able to understand the marketplace in a unique way through the lens of the advisor. And so we understood how important this organization could be and should be to the market. And so I was aware of NABIP. It wasn't a brand new organization to me, but it was a different representation. I also, in that threat analysis, that SWOT analysis, recognized that if we, in boardrooms, we would talk, how can we collect, what is it going to be that helps us move this together? We can't get rid of them, which we thought of, and we tried to, in secret rooms, figure out how do we get rid of the advisor? You can't. And we didn't, and then we recognized, but there's power there. And so now in my role now is I came in knowing the power of the advisor, knowing the power of the broker, knowing what those trusted long-term relationships mean to decision makers. And now the question is, what are we going to do with that power? Because there's power there. And it's all about how we move within that to do and move and shape the future of healthcare for the better. And NABIP's mission is, that's our tagline, shaping the future of healthcare, ensuring our vision is that every American in this country has access to high quality, affordable healthcare. That's a very similar mission to PBGH. So from an ethos perspective, we're aligned. Now it's, how do we navigate that within the complexity and diversity of a system that hasn't been aligned? And that's what I'm really energized about. And when I meet, my aha moments is recognizing that everyone isn't created equal, right? It's not all the same. I speak to community-based independent agencies that know and love their people, who really want to do the right things, and in some ways just don't know how, and some do know how and are doing them. And so that diversity that I've been introduced to within this ecosystem, this segment of the industry, has been a very great aha moment, one that's been a positive one, because I came in saying, okay, how are we going to fix them? Right? Because they're clearly they're broken, and they don't know that their customer doesn't even trust them. And so I have been sharing that your customers don't trust you. And when was the last time you asked them if they do? Do they need you or do they trust you? And those are two different things. But I also realize there's not a lot of fixing I have to do. It's more bringing us together in the how. And it's not only fixing, like you're wrong and I'm sent to fix you. That's not the case. I have so many willing, I call them, we're part of an army, like we're coming together to avenge this thing and called healthcare, and we're going to do it collectively. But the how is really, really where the rubber meets the road.
So when it's such an interesting thing. I mean, do they need you or do they trust you, right? Because in the way the model comes out of the box, right? And I am somebody who spent a lot of time at a bigger firm. And I'm going to say that at one point I thought we were bigger than the industry, meaning like we told the carrier what to do because we were the advisor. And so my degree is in risk management insurance. The role of the advisor is to represent the employer and the employer only. So I can't tell you how many meetings I sat in and says, I don't care what you want me to do, Mr. or Mrs. Carrier. That's my client over here. But there were times that, this very confident 20-something-year-old advisor right here back in the day got put into place because sometimes the tail does wag the dog. And if you said, we're going to wipe it clean, we're going to take the whiteboard, we're going to pretend like none of this ever existed before, understanding that you're now in the middle of that Venn diagram, right? You now, advisors are here, employers are here. What are some of the components that lead to a perfect Venn diagram? What would be like a really nice place in the middle that everybody, gelled at?
It's interesting. So I've seen the larger firms in the marketplace, but when it comes down to it, you put them together, they don't have as much as a market as they think they do, right? And they don't have as much power as they think they do. And so when they say, well, we're the advisor, we represent the employer, then they get smacked against the head by the carrier, right? Like, oh yeah, you're not as powerful as you think you are.
Right.
And because we now own the providers, we now own this, we now own that, what are you really going to do? Are you going to cause disruption? Which was like the F word, like the 4-letter word, right? Like disruption is like the worst thing ever. And a CEO gets a call from an employee, it's disruption. Or God forbid it be the CEO's wife.
Right. 100%.
And it's the worst thing ever you could have done, and that's the best thing for the majority. But what I heard oftentimes when we got carriers in the room alone is that they would say no to our face with the employers in the room, because and they would say, unless you guys are going to back us on this move, we're not making the move. And the reality is, it was hard to get the backing. The middle manager, HR benefits leader, and those in the room were progressive. They wanted to be, at least, but they weren't, and they aren't largely still rewarded for risk. They're not rewarded to make progressive decisions. And so as a result of that, the executives of these and carriers understand that, and the advisors understand that, right?
100%.
So that if they're not rewarded for risk, is the advisor rewarded for risk? I put you in an unknown PBM, transparent plan.
I mean, nobody ever got fired for hiring IBM. Nobody ever got fired for hiring Blue Cross at the the name brand. You're right.
Right. So that I think is in that epicenter is our what are we measuring?
What's the KPI?
What is the KPI? And we've tried for many years to get the C-suite in the room. I can tell you, I've had benefits leaders tell me they do not want their CFOs in the room. So they're even part of the inertia. So then it's, well, how do we help you be effective articulating this issue and the opportunities to your C-suite, since you don't want us to have direct access? And advisors have the same challenge, getting the access to those decision makers who are rewarded at different levels for different reasons.
Which blows my mind, Jessica. I wanted to get your opinion when you finish this. It blows my mind. Second largest expense of the organization, and the people who run that business don't take time. So I want you to address that, because when you said that, sometimes nobody ever gets the C-suite in the room. It blows my mind to think that, I run a business. I am going to be wherever the money is that impacts my business. And not only the money, some of the major part of the reason somebody works for my organization, right? So you look at it from a recruitment retention standpoint, and you look at it from a fiscal standpoint, and says, there's probably not a better room for the CEO or CFO to be. So I want you to kind of hit on that as you saw that in your eye too, because when you said that, it just dawned on me, like, that's the room they need to be in.
It is. And so I've been in rooms with the C-suite and CEOs of some of the larger companies in the region. And I can tell you, it was interesting because and I heard them say, like, I do aluminum. We're aluminum. Like, that's what I do, right? I work in manufacturing. This is what we produce. I'm in steel. This is not my business. And I think a part of it is the lack of understanding and knowledge, though not wanting to be an expert at what you do, and that healthcare isn't what they do. And in those rooms, I would say, until you have only robots working for you, you're in healthcare. You need to understand you are in the healthcare business. Look at your balance sheet.
Right.
You are in the healthcare business, whether you believe it or not. That is your second industry, in addition to your core industry. And when you begin to have those conversations, it's a journey. But at the same time, in most communities, there is a conflict of interest. These same executives are on the boards of the hospitals. They're on the boards of the Chamber of Commerce, who also have the CEOs of the hospitals and the insurance companies on the board with them. And actually, that's how our coalition started. They were on the boards together. Costs were going up. And they said, well, we need to create separate rooms. And the employer coalitions largely started by CEOs. And then over time, they started delegating the role to HR. And once one company started delegating the role to HR, then CEOs didn't want to be, they wanted to be with other CEOs. So then everyone started delegating the role to HR. And that's how it became middle management-led HR work. The CEOs really started the movement of, we have to separate ourselves from the pack and be able to come together to make decisions that's ultimately going to save our companies and our communities and our people. So cost drove them there. The question is, how did their pain threshold get so high that they've been okay with apathy? And now that's changing. I mean, the lawsuits, of course, are changing that. I think Mark Cuban's role in being a peer and calling out executives directly is helping that. And then we have had this great awakening of progressive HR leaders who have decided, I'm not in an administrative role only. I'm a change management role now. And a part of my mission and purpose is to navigate and have these tough discussions and roll this up to the executives. So we have these few, and they are the few in the grand scheme of things. I've been surrounded by many of them, but in the grand scheme, there's so few. And largely, the advisor is going to be the gateway of making that from few to many. That really will be the key. And that's when I talk about power. And if we can create those alignments, and I'm really proud of the fact that I have these two worlds, because my goal is that we are merging them, that we are able to address the SWOT analysis and be in the rooms together where we haven't been and can solve some of these issues collectively. Because when advisors came together and purchasers came together, those carriers that slapped them on the wrist, either one of them had to listen. Mm-hmm. They had to act, and I've seen it directly. And I think that's really the secret weapon that, we haven't fully cracked, but I've witnessed it, and I know it's possible, and it gives me a lot of hope and excitement about what we can collectively do.
So would it be fair, Jessica, that education and exposure is the missing ingredient, right? Like, people don't know what they don't know, and if they kind of knew more and saw more and were exposed to more, that inertia would build up and we'd start getting some more movement.
The literacy, but I think also bad publicity. I don't want to wish that on anyone, but I said prior to all these lawsuits that we're seeing now, which there were lawsuits back in the last 10 years, there's been lawsuits.
Right.
HR benefits leaders and benefits directors have been called out on lawsuits directly as fiduciaries over the years. This isn't the first. The CAA isn't the only reason why we have them, but the level of exposure now is greater. And I do think because of that, it unfortunately had to get to that point where the people, your own people, had to hold you accountable and make you pay attention. And so I think these things can work in our favor collectively. The level of, now I have to get up to speed and know what I don't know. I have to want to know something that I didn't want to know, right? And I have to act on it. And now I have to reward you to help make sure we're protected and our people are protected. So that education, but literacy, just like we talked about literacy, health insurance literacy for consumers, a health literacy for consumers, we have a literacy issue. So you can't speak to a benefits leader and then go talk to the CEO in the same language. This is not their world every day. And so we haven't been great at translating and being able to understand our audience. I think that's part of the challenge with going upstream, up hierarchy within organizations, from benefits leaders to CFOs to, and over the years, procurement officers in companies, those who procure other products, goods, and services for their organization. Many of them are now part of the purchasing. The most progressive employers have included them in their purchasing of healthcare. So they don't have the healthcare knowledge, but they have this sophisticated purchasing. How do I get to the lowest cost, highest quality, get more product in here, greater access, greater value? And so bringing in those diverse skill sets within our organizations, I think, is a really key strategy. And if advisors learn how to work with procurement officers, understand their language, and know how to pull them in, I think that could be a really interesting mix in how we transform decision-making when we're talking about healthcare.
So I want to end the conversation speaking of this literacy thing, because you and I are both involved in something that I know I'm super proud of, which is what I have seen, the one of the first documentaries on talking about healthcare. Out of your mouth, tell me how you describe what the documentary is all about, and what was your burning desire to be a part of it.
Well, Nurse Deb called me and she said, you need to be a part of this. And I trust her, right? I trust the work that she's doing. I believe in the work that she's doing. And we've been on some front lines, not directly together, but around the same time. And so I knew someone like that being a part of it was going to shake things up. And that's really why I said yes. I also thought it was necessary for me representing advisors and brokers to be a part of it. We can't be on the outside of the solutions, and we shouldn't be seen as that, because we're very involved in where healthcare is today, and we'll be involved in where it goes in the future. And a lot of that rests on our ability to have these very unique, diverse relationships, from PBMs and pharma to health insurance to the actual employees of our companies, right? There's not many people in our epicenter, or in our ecosystem that has all those spokes, right? Like we do, right? So I thought it was really important to kind of bridge, again, my two worlds and share the experiences that I've seen on the purchaser side, but also have a call to action for my members today, and to also extend that we want to be a part of this solution moving forward. We have a branding issue in our industry. I mentioned trust with employers. We have a trust in Washington, D.C. I mean, there's literal bills being written right now that only calls out brokers and advisors when it comes to insurance fraud. Like that's being introduced. Like we're the only ones called out. It's kind of insane. We're fighting on the ACA side and the Medicare side this idea of mistrust, and at the same time, people are literally relying on us to help them understand the complexity of the system. And so we're in this very precarious, dangerous place that most people don't get a chance to see. But if we don't come together with documentaries like this to provide the education and the exposure that needs to happen, we will continue to navigate with blinders on. And so I'm really excited about this documentary, and I'm sure others to come. And I love the voices, your voice that was in there, and many others that kind of pulled Diane back, one layer at a time on a different part of the healthcare ecosystem that ultimately our family members experience.
Right.
Experience that you and I probably have stories ourselves and have experienced. So that's really what I'm energized about around the movement around this.
Awesome. I want to leave everybody with, you use one of my favorite terms, calls to action. So I think people are podcast and webinar and conference and seminar out, right? And you get back to normal life and shit happens, right? You get back and you're like, you have all the intentions of the world to, take on the beast. If you had a call to action, you could address employers and advisors differently. You could address them both. What's your one piece of advice that you leave everybody with as we close this podcast?
I would say, your competition is poor quality healthcare. Your competition is the fact that people are splitting pills to be able to take their drugs and also take care of their families. Your competitor is, mass consolidation that doesn't consider the communities that they're in. Your competitor is the fact that someone is going to the same site of care for the same drug with the same physician, and now I'm paying $1,000 more out of pocket, right? Either your company is paying that or the direct employee and their family is paying that, depending on their out-of-pocket maximum. Those are your competitors. And that's what we need to understand so that we can be willing to be in the same room together, purchasers, advisors, other components of the solutions in the ecosystem, insurers, providers, so that we can actually create real solutions, not solutions that are marketed as solutions, but real solutions that have an impact on lives. And so recognize who your competitor is, and maybe they are your direct competitor, but collaboration is the way of our future. That's how we're going to make this work, and I hope that you're willing to do that with us. Obviously, I can't be the CEO of NABIP and not say join us at NABIP, become a part of the solution through NABIP, and allow us to be a force to be reckoned with together.
Awesome. Well, Jessica, thank you so much for shedding the light. I took a page and a half of notes on some things that you said that gave me aha moments. So I know that the audience will get a great aha moment as well. If anybody wanted to learn more about you and or NABIP, where should they go check that out? Please
join us, www.nabip.org. I'm accessible on LinkedIn, Jessica Brooks Woods. I respond, right?
You do.
I'm responsive. Yes, but connect with any of our team members at NABIP, follow us, and look at our socials as well. You'll see a lot of the activity, the education that we're doing. And usually I'm in a city near you. I've been traveling quite a bit, so I'm likely going to be in a city near you. Feel free to reach out and join me in one of those rooms.
Awesome. Jessica, thanks so much for being a guest.
Thank you. I appreciate it.
And for everybody listening, this is another hopefully ear perker, eyes wide open vantage point from somebody who sat on both sides of the table representing, the at least two of the several constituents in this game. So make sure you share. The only way we actually get to change healthcare is to improve the literacy, and that's the whole purpose of this podcast. So Jessica, we appreciate you, and audience, we appreciate you guys. Until we hear you next time and see you next time on another episode of Impact Healthcare. Thanks so much.
You've been listening to Impact Healthcare, people and strategies that are disrupting the health benefits industry with Lester Morales. Remember, the journey to getting 20% savings on your healthcare benefits starts with total transparency. Remember to subscribe to the Impact Healthcare podcast on iTunes or wherever you get your podcasts.